Today, we are going to talk about our virtual family teletherapy program and what makes it unique, especially when compared to other services that are available for students in this age range and for families in general when it comes to virtual school-based mental health services. So, some of you who signed up recently attended a session introducing our new no-cost partnership option for districts. And this family teletherapy program that we'll be talking about today is a part of that. So I wanted to dive deeper into that program specifically, since we've gotten a lot of great feedback about how, the supports that are built into that program. And so that should be helpful for those of you who are looking for more supports for your younger students or who are looking into the no-cost option and want some deeper insight into how we support elementary students in that model. So we'll start by introducing that partnership option and the services it covers to introduce those of you who are new to Daybreak and give context for the program. But we'll start by introducing ourselves. So I'm Erin Weaver. I'm on the school partnerships team here at Daybreak. I've been with Daybreak for about 3 years, communicating our programs to K through 12 districts and building our partnerships with school districts nationwide. I'm really happy to be talking with you all today and grateful for you sharing your time. You are going to hear a lot more about this program from Wendy Youngsmith, our clinical programs manager, who has done a lot to build this program into what it is today and facilitate a lot of these sessions. So Wendy, I'll pass it to you to introduce yourself.
Hi, everybody. Thank you for joining us today. So I'm Wendy Youngsmith. I've been with Daybreak for 5 years now, since we were a Biddy company, and I get to be one of the clinical leadership and the clinical brain on our team. I am a licensed marriage and family therapist, so this program in particular sits close to my heart because I am a family therapy geek, and I am so excited that we get to introduce this program to you for our youth and families so that we can serve younger populations, and a lot of people are comfortable with working with on screen. So welcome, and we're excited to have you today.
Thanks, Wendy. Yeah, we've got the expert here. So I will say we have 45 minutes on the calendar today, and we will not be planning to talk for quite that long because we wanted to make sure that there is space for conversation if questions come up. So please don't hesitate to share your thoughts because we're ready for them. And yeah, there's a lot to think about with this program. So, as mentioned, we wanted to talk over how the no-cost partnership model works and what that includes for some context on the full scope of services that this family teletherapy program is a part of. So again, I think, some of you are familiar, but it might be new to others. So Daybreak now has a no-cost partnership model option, which works through our health insurance partnerships. So Daybreak Health is able to offer partnerships to districts at a budget neutral to them by billing insurance providers for covered sessions. So we are in network with Medi-Cal, Medicaid, the vast majority of private insurance, and we handle that insurance billing piece. We also take referrals for uninsured students, and in those cases, we offer a flat self-pay rate to the family. And so, as mentioned, we'll handle the insurance piece. Daybreak also works with parents to, gather the ROI and manage that aspect of communication. And really want to be a close partner in taking the administrative burden off of school staff when it comes to those communications. So outside of the no-cost partnership option, we can partner with districts to bring in on-site clinicians to conduct our universal mental health screeners. So we have a lot of options for partnership, and I will talk through all of the services that are included in this new partnership model. When we get towards the end, I'll talk a little bit more about what starting the partnership is like, but if any questions come up on that piece around insurance and, how it functions to have a no-cost partnership, just feel free to enter them into the chat. So, looking into what is covered in this partnership. So Daybreak offers a comprehensive K through 12 teletherapy program. This partnership model opens up referrals for students across ages 5 through 19 for our virtual therapy programs. So any student can be referred. When we're working with students who are ages 10 and up, that will be a referral for our one-on-one teletherapy program. So a student and clinician. This is a 12-week CBT-based program that's really intentionally built to, have enough time for these children and teens to work on their independent skill building when it comes to seeing improvements. So, we are an appropriate intervention for students with mild to moderate, in some cases moderate to a little heavier presenting mental health concerns. And we take checkpoints throughout the program to monitor clinical improvement. So you will have access to not just how well students are doing in terms of are they attending their sessions, but you'll have that clinical data to see clinical improvements on symptomatic improvements from students who are referred to completing the program. I will say, so this is, designed as a 12-week program, but we can do a few more sessions if that's determined to be what's best at that point. At the end of the day, the end goal is the same. We want to see youth doing better. So, we are happy to extend that if that's what's needed, but you won't lose that touch point. I know there are some services out there that are, more referral partners for districts, where, you can refer a student, but might kind of lose touch on what happens afterwards. And we do not have that kind of partnership. So you'll have a lot of insight and a lot of collaboration on how the students are doing. So you'll have the discharge summary and a touch point at the end of the program. And that's the same, whether it's one-on-one teletherapy or family. So when we are working with younger students in elementary grades, they will be referred to the family teletherapy program. So again, you'll get some deeper insight into this from Wendy in just a few moments. But with this program, we are still focusing on clinical improvements in the child. But as you can imagine, a one-to-one therapist, session for a 5 or 6-year-old on the computer is not going to be, the right move for an intervention for students of that age. And so we're bringing in the family in a really unique program to work on, creating healthier environments, healthier routines, working on dynamics so that we can reach those outcomes for the child that we're deciding on at the beginning of the program. So these are all virtual services. They're available on or off campus. Some districts do prefer to have an on-site place for these, virtual sessions to happen. We can always talk to you about what that looks like at some of the sites we're partnering with, but the vast majority of these sessions are taking place at home. So these can be accessed on tablet, phone, computer. There is availability before school, after school, weekends, and over summer, which is very helpful for continuity and for a lot of those students that could use the care over the summer and just have that weekly touch point. And another big piece of both of these programs is our clinical matching program. So we put a lot of intention into matching the clinician to the youth receiving services. It is not a random pairing. So we will ask needs and preferences in terms of home language spoken, any, preferences that youth might have to feel more comfortable around, age or gender of their clinician. And then we'll take that information to match them. We have a really diverse clinical team, lots of Spanish speakers, but over 10 different languages are spoken across the team. And so we do put a lot of intention into making sure that, the clinical team that we have can reflect the populations that we serve. I'll dive a little bit more into this in just a moment, but we have a lot of data that you can access so that it's not just on an individual level looking at students' progress, but you are able to track the overall trends of your program. So this is just an example of the kind of information you can see on your dashboard. I wanted to talk a little bit about what this referral process would look like from the school staff side. So, designated school staff can make referrals, school counselors, social workers. Parents can also make referrals. And your school staff will have access to this dashboard where, as I mentioned, they can follow along on progress. Um, that's also where you'll have access to look in and see, data trends across your program, just to continue informing as you go and integrating with your other mental health services and kind of looking at, trends by time, by school site, and just getting a closer look into how the program is progressing with your students. So I mentioned that as a part of this program, parents are able to make referrals. So I wanted to give a little bit more of a glimpse in the information that they receive on their end. I will say, if anyone is interested in getting a deeper dive into the parent, the student, the school staff experience along the referral pathway, let me know after this session. We can, do a demo of it at another time. There's a lot to dive into, but um, the mental health matters one pager you see here, that is to help parents understand the program and just what to expect if their child is referred for services. I know there's a lot of, kind of different levels of understanding of what therapy is and what it does. And it's really helpful to have touch points from the get-go with families and on, what this program is and what its purpose is. Also sharing an example of the parent guide that gives, tips on what the family will need for their student to participate in virtual therapy from home. And then we have an FAQ. My child has been referred for teletherapy. What does that mean? What happens next? And just kind of giving an overview of the program. Last piece I wanted to mention on this partnership, another piece of the no-cost partnership model when it comes to the family experience are monthly classes that we hold. So by partnering with Daybreak in this way, there are free mental health classes available to any families who are interested. And we hold those at the same time every month in English and Spanish. That's just a great way for families to kind of get on board with you and learning more about, signs to look for in terms of youth mental health concerns, how to support in the moment, how to, build more supportive environments, and just kind of get on the same team and reducing that mental health stigma, and being, more aware of, what youth mental health concerns are prevalent and, what signs to look for. So those are live classes, but you'll have access to the recordings. In addition to those recordings, we have, guides and articles and lots of other resources that are available for families to access at any time. And then just wanted to show an example of the referral form that parents have access to. So really including this in the partnership because it takes a village to increase the level of awareness and education community-wide on all of those aspects. And we've gotten feedback from a lot of districts that, having those parent referrals open is helpful. It takes, some burden off of school staff to, recognize every student that might benefit from therapy. There are some youngsters who may be showing more signs at home than in the classroom that they could use help. And so parents are able to make those referrals. So pretty quick overview to give some context on the program that this, family teletherapy lives within. And I'm going to I was about to pass it over to Wendy, but I just wanted to give a little more information on the classes. Shout out for this month's class, March is Understanding and Supporting Youth Anxiety. And we have these the third Wednesday of every month. So this is this year's class calendar, and we always, align the topic for the month. I just wanted to kind of give you an overview there. So we do every month but July, and then we'll start another class calendar next September. And again, these are free for families, free for the district as well. They're totally facilitated by Daybreak. So, looking at what makes the family program unique, I'll pass it over to Wendy. And I know some of these slides are a little verbose. I just want to make a note to you all that I will share the recording after the session. So, no need to take notes unless, of course, you'd like to. But Wendy, I'll pass it to you to kind of go over starting here on determining which students to refer for the program.
Thanks, Erin. All right, so acknowledging that while Daybreak as a mission is committed to helping as many youth and families as we can, this is also just acknowledging that not every setting is right for every family. And so we want to make sure that we're being intentional and targeted when we're communicating with school staff about who is really right for this particular program. Similar to the way that we talk about mild to moderate symptoms in our individual program. These are kids that probably are showing some of these behaviors early on, maybe causing some initial distress, but that the family isn't in active crisis. And so part of this is simply because we are virtual, right? We're not in a room with a family, and that changes some of the dynamics about what we can do in terms of creating a safe space. First and foremost, before we can do any kind of clinical work, we need a safe space, right? So most of the people that we get to serve are already in that space. All right. So we find that districts and families actually are very deeply aware of we could do this on screen, and it makes sense to do this on screen. So what do we tend to see in our younger population? Really broadly, emotional dysregulation is kind of how all of this gets labeled, right? So they have big emotions, and this impacts their behavior, which can include challenges within the context of school or friendship, or maybe there's more conflict happening in the home. And so really this program is meant to be targeted towards addressing some of those big emotions and helping that child and family together navigate how we have healthier interactions or responses to that emotions and what we do when we might feel hard things, right? Again, typical behavioral changes that we might see. You can call it irritability if you want. You can also just call this crankiness. We all experience that sometimes. Maybe they're pulling away from their friends, or they're finding that they have more conflict with them, right? Sudden friendship changes because they're getting into fights. Could be behaviors that we might anticipate from even younger youth, things like tantruming or bedwetting, let's say in a 7 or 8-year-old that had previously moved beyond those things, but is finding themselves in another challenge with that. Routines at home tend to be a big one that parents talk about in terms of a challenge space. How am I helping my child navigate starting the day, getting up and getting to school, but also how am I helping them to navigate the end of the day and calming themselves down so they can feel restful, right? And we all know that, right, lack of sleep makes things even worse, right? So again, some of these basic things in terms of what a family can assist with. Again, families that fall outside of our scope are typically ones where we would be concerned about a safety risk, right? So this could be a parent that's currently battling an addiction and isn't always present and stable at home. We are not appropriate for domestic violence circumstances, even if this is parental as compared to necessarily an abuse circumstance. It means that the parents and what the child is seeing from those parents aren't safe together, right? And we would want that family to receive services that's appropriate for that. Again, this could be like a context where we have an active CPS investigation. A little bit of nuance with this, right? So let's say for all practical purposes, this youth has been really living with a grandparent for a very long time. And then this actually became like a legal circumstance where CPS is now recognizing them as the official guardian. We might be appropriate only because that is in fact a stable home setting that youth is going through. And maybe it's just a transition with how much they do or don't see their parents, right? So again, we're looking for stability in a home setting because we are coming to them into their home, and we have to make sure that that is a safe space. So this is, again, the broadest possible overview really of where we like to enter, right? Some of this can also be family contexts, right? So if we have potentially like a separation that's happening or a divorce, and parents are mostly amenable toward working with one another such that it's not a high conflict. Again, we can be present to help all of those members do some navigation through that process as well. All right, so as promised, I am giving this broader overview about what makes our program so cool. Like I said, I am a family therapy geek, and so I am doing my best to contain my joy and excitement about this program and just delivering what you guys are going to find beneficial, right? So we do roughly 50-minute sessions, and again, it's roughly 12 weeks with some flexibility for extending for longer to meet youth and families' needs. Both the child or children, if their siblings and parents are involved. This is a family program. And there's a few different ways that we decided and arrived at the place and space that family was truly the best program to affect change for these children. A lot of this was research that came out of COVID when everything went virtual by default. Up until that point, family care wasn't really delivered on screen. But what they were finding was that, especially with younger youth, really in that 5 to 10 age range in particular, that doing just play-based therapy on screen, progress stalled until parents were deeply included in that, right? So this is why our program is unique, partly because it's a little more challenging to do. A lot of places will separate these things out where they will have that individual play-based screen time and then have parent coaching accompanying it, but not necessarily putting everyone together. In this case, we do this together with the whole family. Now, that doesn't necessarily mean the whole family is on screen together the entire time. Frankly, that's not a reasonable expectation for a 5-year-old. That's a really long time. So we have the children and the parents moving in and out to be working on different things, right? So we have a virtual interactive playroom that we use in the context of this program to sort of age appropriately teach some coping strategies and skills and create play moments that parents can also do positive reflection or child-led play in that context, right? If you look toward the bottom bullet points, you'll see PCIT there, right? That parent-child interaction therapy. A lot of that is rooted in being able to observe and comment rather than direct what's happening with the play to build that attachment, right? So we can do that in the context of a playroom. In addition to that, all kinds of family therapy really are working on the same kinds of things, including, do we have healthy structure and boundaries at home? Does this child trust that parents are in charge, but in a loving way? Are we attached and connected to one another? If the only time that parents are interacting with their kids is to give directions or to correct behavior that's challenging, then the child, frankly, is going to continue in that more challenging behavior because they want that attention. And so we also want to build into this deep, positive, connected moments for this family that are beyond just working on, again, whatever might be challenging in that particular moment. And again, that's very deeply rooted in that PCIT as well as attachment-based therapy. As a therapist, we get to model this with the child and the parents, and then they get to practice it together in the context of these sessions so that they're already getting the tools in the context of that 50-minute together to then take away to use beyond that session. Right. So in addition to, again, those healthy structures, that strong attachment, typically there's elements of positive communication, right? Obviously, we want parents in charge, and so they are going to be giving some directions, but how are we giving those directions in ways that a child can hear and feel good about, and that parents can feel good about too? I have yet to meet a parent that really loves the sensation of yelling at their child. And so all of this is really honoring the fact that while this treatment isn't therapy for the parents, it is partnering with the parents to deeply increase their confidence and competence that they're meeting all of their child's needs, such that they know that they can be the major support and major influence in that child's life to help their symptoms improve. Just like we on the previous slide about data, a little bit of data in this program. We use the Pediatric Symptoms Checklist 35 to measure care in this program. It is a little bit longer of an assessment tool, so we give it a little less frequently to preserve everybody's time in that, but that is how we measure progress. Again, really we're viewing this through the lens of is this child showing improvement? While we do narratively track family improvement as well, data-wise, this is going to be centered on that child. Again, I mentioned we come into people's homes, right? This is a huge access point. You don't have to put the whole family, maybe with a wiggly 3-year-old and a wiggly 7-year-old in the car and get somewhere after school when evenings are nuts anyways. So we get to come to their families in their home. We get to utilize things like toys in their home sometimes when they play. So the goal is that we get to utilize their comfortable environment to reach them. This is a huge point of access. Again, you'll see those sessions. They're virtual. We do say Monday through Saturday, 8 to 8. A little bit of nuance. If this is a choice to have a family come into school together because maybe they're lacking internet access, this is a whole family participatory program, so make sure that they're not in a broom closet and that you are also okay with having the whole family in a larger room together in a school setting if that is what you're doing. More often than not, where we are seeing families come to us or where we come to our families is in that after school hours in the earlier evenings because we serve a younger population. Typically, these are kids that we're seeing between, the hours of 2 and 6 or on weekends, because this is when the family is most often free together. Again, these referrals would come in under a single use, but we can treat siblings in this as well. Again, we're working on health of the whole family, and that can include multiple children. So often this is a way to targetedly reach several young children who may be attending your schools together, acknowledging that if one kid improves, another one might start to act out, because this is also part of family systems theory, that unless the whole system is working well together, you're inevitably going to have one child that might have a challenge in there. So this is, again, the broadest possible overview. If you guys have any more highly specific questions about the clinical aspects of our program, I'm happy to deep dive into any of that. But if not, this is the overview of that.
Thank you, Wendy. Yes. As I said, Wendy is the person to ask. So if you're curious about anything, this is a great time. Thank you so much, Wendy. That's a really helpful overview. And I appreciate that context of, one silver lining of the pressure cooker of COVID on mental health is that out of necessity, we got to find out a lot more about how to, treat youth virtually. And so we ended up with, data to inform this kind of program. So I appreciate that context. Yeah, and in summary there, I know there are lots of programs that can offer parent coaching. I know there are other services that, offer play therapy. And it is pretty unique that we have this approach that combines both. So again, the focus is still on the child's needs in terms of mental health. And by bringing the full family into those sessions, we're able to really, work on a lot more together as a family unit. So I appreciate that insight. I'm going to hit you with a question, Wendy. Something I hear from lots of folks at districts is that, when this program began, it was because, folks were just seeing mental health concerns show up in younger and younger students, but the same, level and scope of supports just did not exist for students of that age. And, one of the ways that I hear that coming up is like disruptive classroom behavior, students that are kind of acting out in the class. And then, of course, that, affects their classmates and the teacher. Would this be an appropriate intervention for that type of behavior? Could you speak to that for any, school counselors or, school site folks that might be listening in?
Yeah, absolutely. And again, in this program, when we have some of these behaviors happening at school that we're looking to address, we also want to make sure that we are in touch with our school staff. Because there may be some really important things that that child and family are learning together that we can utilize in a classroom setting or help to reinforce in terms of what they're learning with emotional regulation, right? Or if we are creating some better habits at home, maybe that kid is more rested and has more room and isn't exhausted and irritated and it's turning into something bigger. So yeah, I would say that again, consider this in that scope of safety, right? If we've got a kid that has some really severely aggressive behaviors, this might be something that's outside of our scope because that would be better served with a therapist in person who can utilize a little bit more of their physical presence, somatic presence to help in calming and containment and create safety in ways that it's a little more challenging to do on screen. So, that being said, if this is the kid that has like louder anger, bursts, stomping, maybe they're tossing a paper, or they're yelling at a peer, or they need to leave the classroom, or whatever else is happening, we absolutely work with youth that are in that context.
Thank you. All righty. Well, I
Oh,
haven't seen any questions come up. I think you were very thorough, Wendy. Thank you again, Wendy, for sharing your expertise with all of us. Is there anything else you would add before we wrap up today?
no, just if there are any particular clinical questions, I know sometimes people sit with that and then
Mhm.
have the moment of, oh gosh, I should have asked. That I am partnering with Erin, and so she can find me, and we can get you that information.
Absolutely. Yeah. All right. Well, thank you all so much for taking some time out of your days. I really appreciate it. We're really grateful to share this time with you. Again, grateful for you, Wendy, sharing your time. And we will catch you next time. Take care, everyone.